Mr. Chairman, I sought recognition because I view this as a historic moment and I want to draw attention to it. It has now been almost 17 months since our Republican colleagues passed legislation to repeal the Affordable Health Care Act, and since they, a day later, approved the 12 platitudes, the 1.5-page bill that outlined that they weren't just for repeal, they were for repeal and replace, that they would have their own proposal to deal with the problems of tens of millions of Americans who cannot access health care and a health care system in the United States where costs are spiraling out of control. Let it not be said that Republicans have not come forward with a piece of legislation on the replace side, because this legislation is the first time, I believe, in 17 months after passing the 12 platitudes through the House, that Republicans have come up with a proposal that purports to provide access to more health care services to some Americans. Admittedly, it will not come close to the Affordable Health Care Act, which would provide over 90% of American citizens who lack insurance coverage, the people that face personal bankruptcy from an accident or an unexpected illness. It won't provide them much coverage, but it will assure that people who get access to certain kind of over-the-counter medications will now have some tax savings with reference to those. I believe that we needed far more, but at least there is this 1.5-page, 2-page bill that after 17 months, there is something that Republicans are advancing. I don't know if this is their entire alternative to repealing the Affordable Health Care Act, which would do so much to help so many American families, would extend the solvency of the Medicare Trust Fund, is already meeting the prescription needs of so many seniors, but at least they're advancing something. I believe they have not advanced anything more than this one flimsy bill after 17 months because they don't have a better idea. Because addressing the needs on health care of our citizens is a difficult task. The Affordable Health Care Act is the compromise of a compromise of a compromise that began really as a Republican alternative to the Clinton health care measure. It is not as comprehensive as it should be. It's not as good as it should be. It's just so much better than a system that leaves tens of millions of American families facing the alternative of personal bankruptcy if they're faced with a medical crisis. And to offer this measure, which does so little for so few, as the only alternative to that, demonstrates the bankruptcy of ideas and alternatives being offered by our Republican colleagues. We face major issues in this country. There are no free lunches, though we were told for 8 years under the Bush-Cheney administration that almost everything was a free lunch. We need to address this health care crisis by strengthening and improving the weaknesses in the Affordable Health Care Act, and we need ideas from all sides, all parties, all philosophies, but this meager effort is not an alternative to the Affordable Health Care Act. The only alternatives being offered are platitudes, rhetoric, and empty promises. I yield back.